Hello, my name is Dr. Gleb Kartsev and welcome back to another episode with the Tuesday Tips with Back to Health. Today we're going to talk about lateral epicondylitis, also elbow pain. Sometimes you hear medial epicondylitis, that also elbow pain but refers only to the other side. So what is lateral epicondylitis? It's going to be a pain. By the way, this is Sarah, my physical therapy aide, who's going to be assisting today. Lateral epicondylitis is going to be pain in this area of the elbow, also known as a tennis elbow. And don't worry, you don't have to be a professional tennis player in order to receive that diagnosis. Also, we have medial epicondylitis. It's going to be on the inner side of the elbow, right here in this area, also known as the golfer's elbow. No playing golf required to receive the pain in that area. People at age of between 40 and 60, even 35, the lower margin for the medial epicondylitis, are more likely to have that issue. When you can receive it? You can receive it during the work that requires repeated activity with your wrist, with your elbow, such as constructions, when you're hammering something, gardening, when you're taking care of your beautiful roses, cooking for the family, and everything may cause, if done repeatedly, with the load and stress, eventually breaking into the inflammation of the epicondylitis area. So on the map, it's going to be inflammation of this tendon sheets. It could be one specific muscles or multiple muscles. So here's medial, lateral borders. So what we can do, how it's treated. Usually it's treated with the RICE protocol: raise, rest, ice, compression, and elevation. So basically, you may put ice as the first line of defense to calm it down for 10 to 15 minutes. Do not put it directly on the skin. Also, you may start to see a physical therapist for the curing of the problem and working with that to modulate the pain. If you need anything additional, solutions for the pain management, you may speak to your physicians in order to receive pain medication or inflammation control medication. What physical therapist can do for you? Basically, we're going to be working, assessing the areas. One of the simple tests to determine the lateral epicondylitis is to ask the patient to do resisted wrist extension. So elevate your wrist up. Usually the straightforward response is going to be pain in this area. Sometimes it's going to cover the broader area, so the proximal 1/3 of the forearm. Nevertheless, you can be having a trigger points in the area. Same goes to the medial side, but in this case we're going to assess the resisted flexion. With that said, with moving forward with the therapy, we're going to perform the soft tissue work, which may also include ultrasound, may include cold laser that we have in the facility, or work with the grafting techniques. And in addition to that, we can apply the kinesiotaping, which is, I can do very simple technique today. If you have very localized pain in the area of lateral epicondylitis, there's a very easy technique that can be applied in minutes. Sometimes you can do it at home, or your physical therapist may teach you how to do that. This is one of the easy solutions with the kinesiotaping to relieve the lateral epicondylitis pain. You also may use the braces that will cover the extensor tendons. They're going to cover this area and stabilize it. That's one of the parts of the RICE protocol, which is responds for the compression. So this kind of taping that I'm performing right now is going to be directed to create the pull around the tendon and promote the traffic in the tissues, meaning to let the blood enter in the area better and also decrease the tension from the muscle. It's like nicely pulling everything together. Also, you may start doing stretches, but be careful with the stretches, because remember, you have inflammation. If you overstretch the elbow, the flexor and extensor, depends what hurts you, you may extend the pain, you may increase it. So in that case, continue with the icing. Don't do it too often. You can do it 3 to 4 times every 3 to 4 hours, several times a day. If the pain does not go away, speak with your physical therapist or the physician, because it may persist for a while. In addition, we're welcome for any additional questions about the topic. Please write it down on the chart. And that's it so far. Thank you for being with us.